Donald Trump is giving dangerously bad health advice to pregnant women and to parents. In fact, he managed to be wrong 5.5 times in a 55-word tweet, which has got to be some type of presidential record in public health. I'm a scientist. We're going to walk through it one by one through this disaster of a PSA from someone with zero understanding of science or medicine, Trump. Now, Trump said pregnant women don't use Tylenol unless absolutely necessary. Of course, fever itself during pregnancy can be very dangerous for the baby. And this is the part that pregnant women really need to understand, despite all of this fear-mongering that's going on. High fevers raise the risk of things like neurotube defects, premature birth, and other bad health outcomes. That's been very clearly shown. Now, acetaminophen is the recommended option for lowering fever and for easing pain in pregnancy because other fever-lowering medications have clearly been shown to be much less safe compared to acetaminophen. The American College of OBGYNs advises using acetaminophen at the lowest effective dose for the shortest effective duration under the guidance of an OBGYN. And that's always been the case. That's not like some new policy. Now, is there an increased risk of autism spectrum disorder after acetaminophen use? The data are not clear one way or the other. Despite all the confident claims being made one way or the other recently, it's not totally certain. It is true that there was a very big, and why I say very big, like 2.5 million person Swedish study published in 2024, where they controlled for parental health variables and they compared within siblings, and when they did that, they found zero evidence of any association between acetaminophen use during pregnancy and autism spectrum disorder. So, acetaminophen remains the safest choice for treating fever in pregnancy when guided by your OBGYN. And fever in pregnancy is dangerous. So you should really be speaking, not listening to the advice of Trump, of course, but speaking with your OBGYN, who is capable of helping you in your personal circumstance navigate this benefit-risk discussion about, the medicine versus the fever, what's going to be best for you, what's best for your baby. Your doctor can give you the correct answer. Trump says don't give Tylenol to your young child for virtually any reason. Of course, acetaminophen is part of standard pediatric care. It has been for a long time now. The American Academy of Pediatrics publishes very clear guidelines on this, and parents are encouraged to treat their children in the case of discomfort, not necessarily just to treat the number of the thermometer, but in the case of discomfort or distress. And so you should call your pediatrician for answers on this, who can give you guidance on should I be treating in this circumstance, and if so, how much should I be giving? They'll give you weight-based dosing for infants, for example. Now, research shows zero connection between normal pediatric use of acetaminophen and autism. However, there is one thing that I should say, which is that you probably should avoid giving acetaminophen preventatively, before vaccination, to ward off a potential fever from happening. Because there actually is some evidence that using it non-specifically like that prior to vaccination, that can actually reduce the amount of immune protection that you get from the vaccine. However, using it at the appropriate dose after you've already had the vaccine and had the fever, that's a different story. That's totally fine. That will not blunt your immune reaction. And that's true not just for kids, but for adults too. You shouldn't be prophylactically taking acetaminophen before vaccines. So, don't give acetaminophen before vaccination, but if you think you may need it afterwards, please do call your pediatrician for advice on when to give it. They'll give you a clear answer on whether you should, and if so, at what dose. Donald Trump says break up the MMR shot into 3 totally separate shots, not mixed. The measles, mumps, and rubella vaccines have been given together as MMR in the United States for decades, which means that that's the version for which we have millions of data points on the benefit-risk profile, including showing no association with autism spectrum disorder, by the way. Now, of course, technically, you could break it out into 3 separate vaccines that you get instead of a single poke, but there's literally zero clinical evidence or even a convincing theory for why that would be any more effective or any more safe than the combined version. Trump doesn't seem to have one either. He said that this is because of his feelings, which I guess are taking precedence over facts in 2025. What that feeling is based on, I can only speculate. But it may be something like if you're exposed to 3 pathogens at once, maybe it'll overwhelm your immune system or something. I've heard that a lot. It's nonsensical from an actual immunology perspective because your immune system encounters enormous numbers of different microbes and non-microbial antigens every day. It's constantly sampling in your gut, your immune system is, and when you brush your teeth, there's little microabrasions, you get exposed to many different antigens, when you scrape your skin, when you inhale air, and so on. I can tell you with confidence that it's not possible to overload your immune system in the way that is implied here. 3 simultaneous microbes is nothing. It's a drop in the bucket for your immune system. Trump says take chickenpox shot separately. For varicella, which is the chickenpox vaccine, the CDC already recommends giving the first dose separate from MMR instead of giving the combined MMRV, to give the V and the MMR separate injections. So to be clear, that's already the established guidance. Now the reason for that is because for that first dose specifically, safety analyses showed that giving the MMRV instead of the MMR plus V led to a slightly increased risk of having a fever so high that the child had a seizure. And by slightly increased risk, I mean about 1 in 3,000. But if you give them separately, that doesn't happen. And that's for the first dose. For the second dose, the combined MMRV has 0 additional risk of febrile seizure, so it's totally fine to give the MMRV for the second dose. So what is already done is you get the MMR plus V, usually 2 separate injections for the first dose, and then the MMRV for your second dose of the chickenpox shot. That's why he's only half wrong. Giving it separately has already been the guidance for a long time. Trump says take the hepatitis B shot at 12 years old or older. Now, before the hepatitis B vaccine was recommended at birth, there were about 20,000 infections in children each year, children under 10. Now it's down to, I think, close to a few dozen. Getting that dose at birth prevents infections that can be passed down during delivery, or even if the mother is known to be negative, it also protects against infection through close contacts with other people in infancy and in childhood, with other people in the house, with other caregivers or children at daycare, and so on. I think what Trump doesn't understand is that you can get hepatitis B from microscopic amounts of blood. I get the impression that he thinks this is exclusively a sexually transmitted infection, which is simply incorrect. Certainly, you can get it from intercourse, but you can also get it through exposure to bodily fluids in many other ways that an infant might be exposed to. And by the way, about 15% of pregnant women aren't tested for hepatitis B because of not very good access to OBGYN care during pregnancy and so on. So for children that get infected in infancy, there's a 90% risk of developing lifelong liver infection that can lead to end-stage liver disease or liver cancer. And we combine that with the fact that some women don't get tested, and about half of people overall, this is an important statistic, half of people overall with hepatitis B are totally unaware of their infection status, including potential people that the child may come into contact with early in life, separate from the mother. Of course, there's also millions of data points showing good safety and good efficacy for the birth dose, and there's 0 clinical or scientific rationale for why pushing it back to later would be any more safe or any more effective. In fact, it would obviously be much less effective because those 20,000 new infections we were talking about per year were in children under the age of 10. So if you're only starting vaccination at age 12, you have no protection against those tens of thousands of totally preventable infections. So this recommendation doesn't make any sense whatsoever, unless you don't understand the disease and you think the only way you can get hepatitis B is from intercourse, which is incorrect. And by the way, recommending the birth dose, it doesn't mean anyone is forced to get it. What it means is that insurance providers have to cover it if you choose to get it. And I think that distinction is often missed in these discussions. It's not that they're forcing you to vaccinate your baby before you leave the hospital. They're forcing insurance companies to pay for it if you choose to get it. And I do think it is a good idea to get it. Our daughter got it when she was in the hospital. Before leaving the hospital, there's a huge body of evidence supporting the benefit-risk profile for the hepatitis B vaccine. But no one's forcing you to get it. It being recommended means insurance companies cover it. Trump says, importantly, take vaccine in 5 separate medical visits. President DJT. I don't know if Donald Trump went with his children to any of their pediatrician visits, but vaccines are already given over more than 5 visits throughout childhood. I'd have to go back to the AAP vaccine schedule to count them up, but there's more than 5 visits for vaccines during childhood. So I honestly don't know what he's talking about here on the 5 number specifically, but I do commonly see calls for spacing out of the vaccine schedule. That is also not supported by evidence. In my training in immunology and in pharmaceutical sciences, I've never come across any benefit to spacing out vaccines further than they're currently given. There's no convincing rationale even for why that would change the safety risk of vaccines for the better. But clearly what it would do is delay protection if it takes you longer to gain immunity against pathogens. But there is one thing that's true about vaccines and spacing, which is that if you're getting multiple doses of the same vaccine, like an initial whooping cough shot and then boosters afterwards, each booster, you'll see if you look at the schedule, should be at least 3 weeks after the last shot. And that has nothing to do with safety. Instead, it's more effective in how it primes your immune cells. If you give the immune cells some time to mature after the first shot before you come back in to boost, you get a much more robust protection. So all of this is a long-winded way to say that we already have strong data from millions of children that the current vaccine schedule has a good benefit-risk profile. So to just start fiddling around with the timing and splitting up vaccines and changing random stuff without any rationale, without any data, that just introduces unnecessary uncertainty into the benefit-risk profile. And of course, it would be a different story if there was some type of data to suggest that making a specific change would improve safety or efficacy. And if that was true, then I would be all for considering making a change. I think every scientific and medical professional would. But changing stuff just because Trump or RFK Jr. have a hunch, with no data, would be nonsensical. It would unnecessarily put children at risk. Perhaps I should end by saying that I have a 2-year-old daughter. My wife is board certified in pediatrics, and our daughter has received every vaccine recommended by the AAP at the recommended times. You should talk to your pediatrician. You should talk to your OBGYN. Please ignore Trump and RFK Jr.